I think these guidelines have lacked at ASCO, and I think they were felt to be of necessity at this stage, because we do have now also a quite a substantial list of systemic therapeutic approved agents for thyroid cancer, and these agents are approved in different subtypes of thyroid cancers. And the sequencing of these agents is somewhat understood, but not really well established, especially for general oncologists or oncologists who are treating this disease. And so this guideline focused really on patients for the well-differentiated thyroid cancer, at least, who are radioiodine-refractory. In other words, this is after they fail the first line, if you like, systemic therapy, which is radioiodine therapy. And then the question is, how do you treat them with systemic therapy if the need arises? And so there's all sorts of questions related to what agents do you use, what if they have a genomic alteration. The guideline essentially sets an algorithm as far as how to proceed. I think it's a very important guideline, given that it clarifies these points. We also tackle aggressive thyroid cancers, a disease such as anaplastic thyroid cancer, which has a dismal prognosis. However, with recent advances in systemic therapy, especially targeted therapies, targeting, for example, the BRAF oncogene, we're seeing more and more systemic effective therapeutic approaches for this cancer. And so the guideline also attempts to give somewhat of an overview of what these systemic agents are. We don't go too much into the details of the multidisciplinary approach, because a disease like anaplastic thyroid cancer really requires a multidisciplinary approach. So we're not excluding surgery from the equation here. We're not excluding radiation. But it's important, I think, for medical oncologists and others to understand what is the role of each of these systemic agents, including the BRAF inhibitors, including chemotherapy still, because that is still used, including also immunotherapy, which is also getting to be a major part of management of this disease. So we look at this guideline as a first step in understanding systemic therapy. There needs to be more follow-up guidelines, I think, as far as managing toxicities related to these agents, and how best to sequence these agents, and how to tackle emerging resistance mechanisms, because we're observing resistance mechanisms to many of these genomically targeted agents.